Here's 3 very serious diseases that I treat in the hospital pretty much every week. Let's go. Number 3, another disease I see quite often in the hospital is pneumonia. So this is an infection of the lungs. Contrast this from the common cold, which is an infection that's confined just to the upper airways. It doesn't involve the lungs. You do an x-ray of somebody with a common cold, their lungs are going to look normal. But take an x-ray with somebody with pneumonia and you'll see opacities in the lungs. This is indicative of infection. Most often pneumonia is caused by bacteria, but you can get atypical infections which are caused by viruses too. And actually, it sounds kind of funny saying the word atypical because for a solid year we saw so much COVID-19, it didn't really seem atypical anymore. It was actually pretty typical. In fact, there were even times when the majority of the patients I was taking care of in the hospital were admitted for respiratory failure due to pneumonia due to COVID-19. But pneumonia can happen to anybody, although I will say it's pretty rare for me to see younger, otherwise healthy people coming in with just a random bacterial pneumonia. It does happen, but it's not too often. A more common scenario is actually somebody who is older, maybe they got comorbidities like a chronic kidney disease or especially history of stroke. If they're not able to handle the secretions, oral secretions normally, what can happen is you can aspirate. These secretions go down the wrong pipe, so to speak. They end up in the lungs, and this can cause a bad aspiration pneumonia. That's a very common occurrence. To treat pneumonia, first and foremost, you got to take care of respiratory failure. If that's going on, you have to give supplemental oxygen, maybe some breathing treatments to help open up the airways, chest physiotherapy to help break up secretions in the lungs, help the body get rid of them. But the mainstay of treatment for pneumonia, because this is often a bacterial disease, you guessed it, it's antibiotics. A common combination that started in the emergency department is ceftriaxone and azithromycin. Or you could also do ceftriaxone and doxycycline. We call this empiric antibiotic therapy for a community-acquired pneumonia. So you treat both common bacterial infections like streptococcus and also cover atypical infections like Legionella. And number 4, another disease I see quite commonly in the hospital is a heart attack, otherwise known as myocardial infarction. So this is different from congestive heart failure. This implies that the heart muscle itself is not getting the optimal blood flow. This can commonly happen in one of 2 ways. Number 1 is you get plaques in the coronary arteries. The plaque can rupture. This causes blockage in a coronary artery and leads to a massive heart attack. This can manifest as a STEMI or ST elevation MI. We see this on an EKG. This is very serious. This is the worst kind of heart attack. Immediate intervention is needed. Another scenario is you can have what's called a type 2 myocardial infarction. This is where there's no plaque rupture, no complete blockage of a coronary artery, but rather for whatever reason, the heart has increased oxygen demand. We call this increased myocardial demand. This can be from infection, sepsis, maybe the heart's beating like crazy because there's a massive infection in the body. This could also be from congestive heart failure too. The heart will put the heart under extra stress, and we can see this manifest as a type 2 MI. So how do we diagnose this? Well, it's all based on the cardiac enzymes. So we draw a blood test and we're looking for troponin. Troponin is a protein that's found in heart muscle. It should not be found in the peripheral blood. If it is, you can think of that almost as intuitively like little chunks of the heart falling off because they're damaged, falling off into the bloodstream. And so that's how you really diagnose a heart attack. Even one that isn't technically a STEMI, even if you don't see the changes on EKG, you can still look for the cardiac enzyme. Treatment of myocardial infarction depends on what's causing it. It depends on if it's a type 1 or type 2, but commonly we'll give aspirin. That's an antiplatelet agent to help with the blood flow. Also, heparin can run this in a continuous infusion in the IV. Also, this will help restore blood flow. But definitely in the case of a type 1 MI, revascularization is key. So you definitely want to contact the cardiologist on call for an angiogram. This is a procedure where the coronary arteries are evaluated using a dye, and it's done in an operating room environment. Sometimes if there's blockages, the cardiologist can actually help to open these up using stents. So it's not only diagnostic, but also therapeutic. And finally, number 5, another illness that I see quite often, pretty much every week in the hospital, is stroke. So we already talked about a heart attack. You can think of a stroke as essentially a brain attack. It's a similar situation where you have an organ, in this case the brain, which is not getting the optimal blood flow to certain parts, and this causes death of brain cells. And so we call this a cerebral infarction. And yeah, kind of like myocardial infarctions, it comes in different varieties. You have thrombotic strokes where there's a clot occluding blood flow to the part of the brain. There's also hemorrhagic strokes where you have bleeding that leads to the stroke symptoms. I think probably many of us are well aware of what symptoms of a stroke are. These would be neurologic deficits, so facial droop, sudden slurred speech, weakness, especially weakness on one side of the body. These can all be symptoms of one part of the brain not getting the optimal blood flow. It is kind of scary. Sometimes the symptoms are a little bit more subtle. Sometimes just persistent dizziness can be a stroke in the posterior circulation, the back of the brain. So it does take a very careful physical examination to identify symptoms of a stroke and then move forward to the next steps, which typically would involve imaging with a CT head and a MRI brain. And just like a heart attack, treatment of a stroke, it can be quite diverse. There's actually a whole subspecialty of neurology that's dedicated to diagnosing and managing strokes, but it also involves antiplatelet agents to help restore blood flow. Can also involve interventions too. Neurointerventional radiologists can do angiograms, cerebral angiograms, place stents if needed to help improve blood flow. And then a big part of treating strokes is then working with physical therapy, occupational therapy, speech therapy to try to restore some of the function that was lost as a result of the stroke. All right, so that's 5 common diseases that I see pretty much every week, if not every day on the wards. And in doing this, I realized that there's so many more that I commonly encounter. I think I need to make a part 2 and maybe even a part 3 to this video. Other common ailments include gastrointestinal bleeding, see that very often, skin infections, cellulitis, heart arrhythmias, seizures, and the list goes on and on. So I'll probably, in fact, I'll definitely make a part 2 to this video coming up. Okay, so if you enjoy medical content like this, feel free to hit the subscribe button there. Also, check out another video here, right here, and I'll see you guys next time.